Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for their acute and chronic medical needs. I do this through my telemedicine, primary care, concierge medicine, as well as vaccines and COVID testing. So good afternoon, everyone, and happy Memorial Day. I thought we'd come on today to have a little chat. We do this frequently at this time of the year to kind of talk about some of the things that we may be concerned about. So let's talk about vaccinated versus unvaccinated. As many of you are aware, the CDC has recently changed their guidelines to state that fully vaccinated Americans can discard their mask and need for social distancing outdoors and in most indoor settings. So let's chat about that for a minute. And let's talk about what that means. The primary thing that you have to do first is determine which group that you fall, whether you're fully vaccinated or whether you're fully vaccinated, whether you are partially vaccinated, or whether you're not vaccinated at all. Okay, so let's take that consideration. One of the things we have to remember is that at this point, there have been over 132 million Americans have been vaccinated. So that's over 40% of the population at this point have been vaccinated. So let's talk about first the people that are unvaccinated. So if you're not vaccinated, or if you're partially vaccinated, if you're not fully vaccinated, you're only partially vaccinated, you're not fully vaccinated. So that particular guidance by the CDC does not apply to you because you're not fully vaccinated. That applies to people that are fully vaccinated. So if you receive Pfizer or Moderna, that means receiving both doses, and/or Johnson & Johnson is just one dose, okay? So for people that are not vaccinated, you have to remember, if you have no vaccine, you have no immunity, unless you've been positive for COVID in the past, right? And we know that that immunity, that natural immunity you get from the infection, lasts anywhere from 6 weeks to 3 to 4 months is what most scientists have found when this has been researched, okay? So no vaccine means no immunity unless you've been COVID positive. And then if you have been COVID positive, that immunity is only going to last for that certain amount of time. That studies have shown. So that's the first consideration for you not being vaccinated. No vaccine means no immunity. If you don't wear a mask, no mask means no protection against COVID-19. Don't forget, we have 3 pieces of the arsenal that we use to help fight COVID-19, right? We've talked about that before, having the 3 pieces of armor in our arsenal to help fight COVID, and that being hand washing, masking, and social distancing. So no vaccine, no immunity, no mask, no protection. And then number 3, for those of you that are unvaccinated, as you are considering your activities this weekend, please remember and don't forget, don't underestimate simple things that we know that have worked, like hand hygiene and social distancing, in addition to wearing that mask. I encourage anyone who's unvaccinated to keep doing those 3 things that we know work. You need to mask up, you need to make sure that you're washing your hands, and doing social distancing. Please remember that the guidance recently released by the CDC, if you have not been vaccinated, does not apply to you. There are a lot of people that are forgetting this. They're saying that, oh, the masks are coming off, right? If you are not vaccinated, that guidance by the CDC doesn't apply to you, okay? So let's talk about 3 top considerations this Memorial Day for people that are vaccinated, okay? The things that we have to kind of keep in mind. Number 1 is children under 12 are not vaccinated. So what does this mean? This means that COVID can still circulate in those populations and children that are under 12. So make sure you consider that as you're considering your barbecues, outdoor gathering, getting together with family, and making sure that we still use those tools that we know work: the masking, social distancing, and hand hygiene. So second consideration, if you're vaccinated, don't forget you're vaccinated, so you're protected, right? That offers you a certain level of protection. Don't forget, if you're vaccinated, immune system, you're still vulnerable to infection due to the fact that you have a weakened immune system. So you have to assess your personal risk tolerance. What is it that you're willing to do or not do, or take a risk of doing, and making sure that you consider that before you attend certain activities, okay? Especially if you're considering attending an event where there are other individuals that are not vaccinated, okay? Last consideration for people that are vaccinated, consider where you are, where you live in the country. Are you in an area where there is a large amount of variant strain circulating? Where the numbers have been relatively low. Make sure you consider that practice, or consider that as you're making a decision how you socialize with your family over the weekend. If you, and so I was asked this question by a patient, so I told them I would answer it here. If you have a barbecue and you're outdoors, a lot of people have asked, so what does that mean? Do we have to wear a mask? Do we not have to wear a mask? If you're outdoors and you're fully vaccinated, the CDC has made a recommendation that those patients can be outside without a mask. Now, the considerations mainly are if, masking indoors. However, if you are attending a gathering and there are a lot of unvaccinated people there, I would consider continuing to still wear a mask around those unvaccinated individuals. One of the guidances talk about if you're going indoors, you can be around someone that's not vaccinated, one family or one person, right? If there are multiple families or people that are not vaccinated, consider still masking, especially if it's an indoor event, but definitely consider it if you're outdoors and making sure that you're outdoors in an area where there's plenty of ventilation and plenty of space for people to move around. If you're barbecuing outside and let's say you're serving food, consider having one designated server instead of having everyone touch the utensils to be able to touch surfaces. The likelihood that something will transfer, especially in someone vaccinated, are minimal, but that's just another way to help, another added layer of protection for your event. Secondly, if you have a pool party, make sure that everyone uses their own towel. Okay, so that's another way that we can very simply do that. I just want to point out one thing that I came across in our research today was a study that was done in the state of Georgia that looked at the rates of COVID transmission infection in elementary schools in Georgia, and they found that in the schools that required the teachers and staff to wear masks, there was a decrease of at least 37% of COVID-19 infections in that population. And so the reason that's important is because the thing that's tied to is wearing of the mask. So wearing that mask offers a layer of protection that unvaccinated people should definitely continue to utilize in every situation. I will definitely, personally myself, if I'm in a situation, because someone asked me, okay, when would you consider not wearing a mask indoors? If I'm around fully vaccinated people and I'm around a group of individuals that are fully vaccinated, I would consider not wearing a mask then. If I'm around anyone that is not fully vaccinated, I'm definitely going to mask. So that's just something to consider. Just thought that I would highlight some of those things. Some of those are questions that patients and people have asked me that we are addressing. Does anyone have any questions? Hey, sorry, Rochelle, how are you? Hey, Miss Bryant, how are you? Thank you for tuning in. Does anyone have any questions? The main thing is to just consider as these guidelines are being changed, you have to remember, let's think about how we got here, how things were a year ago, right? What Memorial Day looked like a year ago. A year ago, it looked like no one was pretty much going much of anywhere. Well, now we have to consider, nearly half the population in the country is vaccinated, which is great, which is causing decrease in the number of cases, decreases in deaths, and decreases in the severity of infection from COVID-19. Well, we also have to consider Okay, so sorry about that. Just a little technical difficulty there. But what we're sharing is one of the things that we have to consider is that if you are not fully vaccinated, then you are not, if you're not fully vaccinated, sorry about that. If you're not fully vaccinated, then you have to consider that you still are at risk to contract, you're at a higher risk to contract COVID-19 while you're out socializing with other individuals, right? And so we need to make sure that we don't forget those three pieces of the arsenal we started with literally a year ago. Same thing, principles exist today that can aid you in decreasing the risk of spread of COVID-19. That's hand hygiene, making sure that we wash our hands several times a day. Secondly, making sure that we mask when we go out and leave our home. And then thirdly, making sure that we're practicing social distancing. So I hope that this was very helpful for you. Does anyone have any questions? Anyone have any questions? Okay. So no questions? Okay. So if you guys are in need of COVID testing or COVID vaccines, definitely give us a call. Our office number is 205-291-8842. I ask that you guys stay safe and let us know if we can assist you in any way. Happy Memorial Day. Bye-bye.